Joining me now is Dr. Sophia Jan. She is the Division Chief of General Pediatrics at Cohen Children's Medical Center in New York City. Dr. Jan, welcome. Thank you for being with us. So as we just mentioned, the trials for children are much smaller than the original trials for adults. And this, of course, is something that might concern some parents. So what would you say to your own patients about getting their children vaccinated?
Basically, the way these clinical trials are conducted is that they make sure that they enroll sufficient numbers of children that they can draw appropriate scientific conclusions that it is effective or it's not. So in some cases, you don't need to enroll as many children as you did for the adults in order to draw some of the same conclusions.
So are the doses different in these trials for children?
I actually am not so sure whether or not the dose is going to be different or not. At this point, what they're going to be testing is the efficacy of the vaccine on younger children. I'm very excited that they are starting these vaccine trials for the younger kids for sure, because we have seen amongst the adults that it has shown tremendous effectiveness in preventing the significant complications of COVID. And now we are finding that there's evidence that there is probably decreased asymptomatic transmission between people who've gotten the vaccine. In other words, that it's harder for you to transmit or sort of, give the COVID illness to someone else. And if that is true for children, it'll be a huge step forward for pediatrics, particularly as we try to get children back into school.
And we are in phase 2 of a 3-part study, which is expected to take 14 months to complete. So what kind of timeline could this put us on in terms of getting children back to school? And also, will that matter, considering the fact that many educators will probably be vaccinated by the fall?
That's a fantastic question. I think that the vaccine will add an extra layer of protection to help kids return back to school. However, whether or not we return back to school now isn't dependent on the vaccine. As you know, as you sort of stated, that many teachers are already getting vaccinated, and we have already found that the social distancing policies as well as the universal masking policies have been very effective at preventing spread of coronavirus amongst children.
Mm-hmm. Now, I'm glad you brought up the social distancing policy, because there has been some pushback against that federal recommendation to space kids of 6 feet apart in classrooms. Some schools simply don't have that kind of space to accommodate everyone. State governments and those trying to get more kids back into school are pushing for 3 feet separation. And this comes as a study published in the journal Clinical Infectious Diseases says that if masks are worn, students can sit 3 feet apart. What do you think of that?
Well, I reviewed the study, and this took place. They looked at sort of the school districts that were in Massachusetts, and they analyzed whether or not having a school policy mandating 3 feet or 6 feet or greater social distancing resulted in higher rates of COVID infections in the school districts. And what they found was, in this very, very important study, was that it did not, the main driver of whether or not there were higher rates of COVID in the school districts was really based on sort of whether or not there was a lot of COVID in the community. And that at least a school policy of whether or not you had a mandated 3 feet versus a mandated 6 feet social distancing policy did not seem to be a major driver. I will say that there are some limitations to this study, which is that we are looking at whether or not a policy of social distancing 3 feet versus 6 feet made a difference in rates. But it is possible that some of those school districts that had a policy mandating 3 feet actually were able to keep their students more socially distant in the classroom. And so their actual implementation may have been a little bit different from what the official policy said, particularly if, schools were not, that parents are not all opting to come into school at this point, and some parents are still opting to be hybrid or entirely remote. So I think there are some limitations to what we can draw from that study. But at the very least, it is building on increasing literature that suggests that um, schools who have policies that allow for 3 feet social distancing appear to be just as safe as those who have policies that have 6 feet. And again, there's discrepancy even between what the CDC recommends and what the WHO, the World Health Organization, recommends. The World Health Organization right now is comfortable recommending 3 feet of social distancing. The CDC maintains a more conservative standard of keeping it at 6 feet, although that may be changing depending on sort of this study,
And of
and as
course, we
well as
don't know
emerging
whether
ones that
the
are coming out.
teachers.
Sorry, go ahead.
Right. No, and I think, it's interesting looking at all of these factors, including perhaps the most important one, which is that more and more educators will hopefully be vaccinated by the fall, which will certainly help whether the desks are 3 feet or 6 feet apart, correct?
Absolutely. And we know from a lot of the international studies that there is sometimes spread. More of the spread comes from, if they're going to be spread in schools, it comes from adults to children, and so that seems to be a little bit of a higher risk, particularly amongst younger kids, than spreading between between students. And so consequently, having teachers vaccinated will make a big difference.
That's a very important point. All right. Well, Dr. Sophia Jan, thank you so much for joining us. We appreciate your time.
Sure. Thank you very much.